students, today we can study about the extrahepatic biliary apparatus. This extrahepatic biliary apparatus means the structures which helps in collecting the bile. So this is our liver. So the liver secretes bile and this bile will be collected by some duct. They are known as hepatic ducts, and this hepatic ducts carries the bile, and this bile gets stored in the gallbladder. This is the gallbladder. So gallbladder will store the bile, and gallbladder will concentrate the bile, and the bile and concentrated bile then again passes through the duct of gallbladder. This is known as cystic duct. Then cystic duct joins with the hepatic duct to form bile duct. Then this bile duct joins with the pancreatic duct and opens into the second part of the duodenum. So this is first part, this is second part of the duodenum. So the entire apparatus, the entire structures which helps in this collection of bile, storage of bile, and delivery of the bile into the second part of the transmits the bile to the second part of the duodenum. So these structures are known as extrahepatic biliary apparatus. Okay, so we will look in details what are the structures. Okay, so see, the structures are first one, right and left hepatic duct. This is right lobe and this is the left lobe of the liver. So here we can see the right hepatic duct and the left hepatic duct join together to form the common hepatic duct. The common hepatic duct joins with the cystic duct to form bile duct. The bile duct then joins with the pancreatic duct and opens into the second part of the duodenum through the ampulla, into the interior of the second part of the duodenum. And here we can see the gallbladder is there. Yeah. So the right and left hepatic duct. The right hepatic duct drains bile from the right lobe of the liver, and the left drains bile from the left lobe, and they emerges through the porta hepatis. We already studied the hilum of the liver. So this is known as porta hepatis. So the emerges through the porta hepatis. Then they join together to form common hepatic duct. Okay, near the porta hepatis. Then it runs forwards and about 3 centimeter it is joined by the cystic duct. Cystic duct. Yep. Then both together forms the bile duct. Yep. Cystic duct to form common bile duct. This is the bile duct. Yep. Then coming to the gallbladder, this is the gallbladder. Okay. So gallbladder is a pear-shaped structure which is seen towards the posterior surface of inferior surface of the liver. So this is the liver. So towards the inferior surface of the liver we can see a pear-shaped reservoir that is known as gallbladder. Okay. So it is situated in the fossa for the gallbladder in the inferior surface of the liver. Then it is about 7 to 10 centimeter in length. So it has a length of about, this is gallbladder, so it has a length of about 7 to 10 centimeter, and it has a width of about 3 centimeter, which is at the widest part, 3 centimeter width. Okay, and it has a capacity of about 30 milliliter. Okay, it stores the bile up to 30 milliliter. Okay. Then parts of liver, so parts of gallbladder. Okay. Gallbladder has 3 parts. Fundus, this part is known as fundus. The terminal part is the lowest part of the gallbladder, which is known as fundus. Then the main part is known as body. Then this portion, the portion is known as neck. So it has a fundus, body, and neck. Yep. Fundus is the anterior free expanded portion of the gallbladder. So it projects beyond the lower inferior border of the liver. So it is a project beyond the inferior border of the liver. So this portion is known as fundus of the gallbladder. Fundus. And the main portion comes in contact with the anterior abdominal wall at the junction between the ninth costal cartilage and anterior abdominal wall. Okay. So here this portion, so fundus will comes in contact with the anterior abdominal wall. I am showing the diagram. So usually this portion, this is the fundus of the gallbladder, so it can be seen beyond the inferior border of the liver. This is the inferior border of the liver. Here we can see this portion is the fundus of the gallbladder. So this portion will come in contacts with the anterior abdominal wall. See, this is gallbladder. So it comes in contact with the anterior abdominal wall at the ninth costal cartilage. Here comes the ninth costal cartilage. So at the right side, ninth costal cartilage comes in contact with the ninth costal cartilage. So this is the entire portion. Here we can see this is the fundus portion. This is body. This is the fossa for the gallbladder. You can see a depression on the liver. That is fossa. So that is the fundus. Then comes the body of the gallbladder. So body lies behind the fundus, and it is the main part of the gallbladder, and it continues upward as the neck region. Body, this is the main portion, that is body of the gallbladder, and the upper surface of the body is not covered with the peritoneum, but it is in direct contact with the liver. See here, the upper surface will be in direct contact with the liver. Okay. And it continues upwards as the neck region. The neck, you can see this is the neck. This is funnel shaped structure. It's a funnel shaped structure, and it at the right side of the neck we can see there is a pouch, or there is a bulging can be seen. This is known as Hartmann's pouch. Hartmann's pouch. So this Hartmann's pouch is the common site for the gallstones, gallbladder stones. Okay, gallstones, most common site is the Hartmann's pouch. Okay. And this neck continues as the cystic duct. So this is the cystic duct. Here comes the cystic duct. This is the duct of gallbladder. Duct of gallbladder is known as cystic duct. It is about 3 to 4 centimeter in length. 3 to 4 centimeter in length, emerges from the gallbladder and joins with the common hepatic duct. Joins with the common hepatic duct to form bile duct. And when looking at the inner aspect, interior of gallbladder and also the cystic duct, gallbladder we can see mucosa. The mucosa of the gallbladder, it is lined with a special type of epithelium, that is brush bordered epithelium, columnar epithelium with brush border. Then there is no submucosal layer, and we can see there is smooth muscle layer, muscular layer, and inside the muscular layer we can see the elastic fibrous layer. Fibers also can be seen in between the elastic muscular layer. There is inner circular and outer longitudinal muscles can be seen. Then outer to the mucosa layer, it will be covered with serosa or the dentition. But in case of mucosa of the gallbladder, we can see numerous foldings. Small foldings can be seen inside the mucosa. So here it is not smooth. So foldings can be seen, and it helps to absorb the excess water from the bile and helps in concentrating the bile structure. So mucosa will be folded. It helps in the absorption of water and helps in the concentration of the bile. Okay. So it is the gallbladder. Coming to the cystic duct also, you can see the mucosa presents a spiral foldings which act as a valve. This is known as spiral valve of His. This here we can see mucosa. It is folded like a spiral foldings can be seen, spirally folded, which forms the valve, that is known as valve of Hister's valve. Okay. Then this cystic duct joins with the common hepatic duct and forms the bile duct. Then bile duct, it is formed by the union of cystic duct and the common hepatic duct. It runs downwards and within the free border of the lesser omentum, then along with the portal vein and hepatic artery. Okay. So the cystic bile duct runs downwards. Bile duct runs downwards along with the hepatic artery and the portal vein and hepatic artery, and deep to the first part of the duodenum. Okay. Then it reaches the descends behind the first part of the duodenum, then behind the head of the pancreas, and reaches the joins with the main pancreatic duct. Joins with the main pancreatic duct and opens into the finally joins with the main pancreatic duct to form ampulla of water. It forms the ampulla of water. So this is the, here we can see, joins with the main pancreatic duct and forms the ampulla. This is known as ampulla of water, and it finally opens into the second part of duodenum, about 8 to 10 centimeter from the pyloric end of the stomach. From the pyloric end of the stomach, 8 to 10 centimeter below, it opens into the second part of the duodenum. Ampulla of water. This is known as ampulla of water or hepatopancreatic ampulla. It opens into the second part of the duodenum. So this is the this structure, all these structures. It is starting from the right and left hepatic duct, common hepatic duct, cystic duct, gallbladder, then bile duct, then pancreatic duct, and hepatopancreatic ampulla. So it opens into the duodenum. So up to all these structures, they contribute to the extrahepatic biliary apparatus. So all they forms the extrahepatic biliary apparatus. So that's about the apparatus. Then coming to the applied anatomy, so gallstones. So gallstones can be seen before that we'll talk about the blood supply and nerve supply. It is supplied by blood supply. Blood supply is mainly by the cystic artery. Here we can see this is the cystic artery, branch of hepatic artery. This is our hepatic artery. So right hepatic artery. Okay, this is right lobe. So right branch of right hepatic arteries. Here we can see cystic artery. So main arterial supply is by the cystic artery. Then pancreatic branches from the pancreatic or duodenal artery also it supplies the extrabiliary apparatus. Then right hepatic artery also will supplies the directly gives branches to the extrabiliary apparatus. Then venous drainage. This venous drainage is by the cystic vein. It's mainly by the cystic vein, and lower part of the bile duct drains into the portal vein. Okay. Portal vein, cystic veins and also portal vein. Okay. The cystic vein opens into the portal vein. So finally it drains into the portal vein. So this is the portal vein, this blue shade. This is portal vein. Okay. Then lymphatic drainage. The lymphatics from the gallbladder and cystic duct and the hepatic duct drains into the cystic node and cystic node. Then finally they drains into the upper hepatic node, cystic node and hepatic nodes. Then finally it drains into the pancreatic or splenic nodes, lymph nodes. Okay. Then nerve supply is by the cystic plexus of nerves, which is derived from the hepatic plexus. Cystic plexus, it is derived from the hepatic plexus, and it is parasympathetic by the celiac plexus and parasympathetic by the vagus. sympathetic from T7 to T9 segments, then parasympathetic through vagus. So that is the blood supply and nerve supply. Then applied aspect. Applied aspect is mainly by the gallstones. So this is gallstone here. So here we can see this is our gallbladder. So inside the gallbladder there will be gallstones will be seen. So gallstones are actually the calcification of stones inside the gallbladder and also the extrabiliary apparatus. So that condition is known as cholelithiasis. Cholelithiasis or gallstones. They are known as cholelithiasis. And next is the Murphy's sign, or the inflammation of the gallbladder is known as cholecystitis. So in case of cholecystitis, there will be if the patient complains pain over the right hypochondrium here, the pain over the right hypochondrium, then when a finger is placed here like this, when a finger is placed just below the costal margin, if they placed a finger, then at the tip of the ninth costal cartilage, and if you are taking a deep inspiration, we can feel a sharp pain in this point. So that is known as Murphy's sign. So at the ninth costal cartilage, at the tip of the ninth costal cartilage, if we place a finger on the ninth costal cartilage on the right side, and if we are taking the deep inspiration, we can feel a sharp pain. So that sign is known as Murphy's sign. So that usually occurs during the cholecystitis. Cholecystitis means inflammation of the gallbladder. So it is cholelithiasis. The cholelithiasis means gallstone. Then cholecystitis means inflammation of the gallbladder. So that's all about the applied anatomy of extrahepatic biliary apparatus.